Welcome to House of Tay Tay. Today we have a special guest, Dr. Kang. สวัสดีครับ
สวัสดีครับ
Dr. Kang, you're the founder of Pride Health. Tell me what Pride Health is.
So Pride Health is the digital healthcare platform that we designed specifically for LGBTQIA plus people and all the other marginalized communities. So people can come in and seek for medical care online. And we do online consultation and we deliver the medications to your door.
What is the mission of Pride Health?
We want to become Asia's leading LGBTQIA plus platform. We want to make healthcare accessible for everyone without having to face discrimination.
And LGBTQ people feel stigmatized. So you want to break the stigma and make it, like a safe space for people, right?
Yeah, of course. Yeah. In order for us to do that, we have created a team of very specialized healthcare providers. Providers are not only trained for LGBTQIA plus people, but they're also part of the community. So they have a very clear understanding of, what people in the community need. They understand the lifestyle. They understand the reality around it. The second part is that we also try to utilize AI tools to break down all the awkwardness that you might face along the way from the conventional healthcare institution.
So what makes Pride Health special and different from other clinics?
That's a great question. So I think number one, of course, is accessibility. Because we're an online platform, there's no physical boundaries. Whoever you are, wherever you are within this region or all around the world, you can access our platform to get the healthcare with the same standards as we do provide here in Thailand. Number two is the specialization, as I mentioned earlier. And number three, of course, is the AI frontier of it. We try to integrate AI tools in order to make your journey with our platform as smooth as possible. So I think these are things that differentiates us from
normal
the
clinics.
conventional healthcare. Yeah.
So you get government support as well in this, amazing project.
Very happy that we got support both in the regulatory front and also from the private sector as well. On the government front, we do work closely with the Ministry of Health.
The platform has been approved by the Ministry of Health.
Correct. Yeah.
And you have all the licenses.
We have all the license to
So
operate.
it's fine. It's
Yes.
totally certified.
We also work with DEPA Thailand and Enterprise Singapore. We also partner closely with Srirat Hospital and Shield Medical Center, which is my clinic. And also, we got a lot of support from A2D Ventures and from First Move. So I think this ecosystem that we created is a testament that people do believe in this idea that healthcare for LGBT is something that is very essential. Yeah.
And the work that you're doing is beyond,
Thank you.
exceptional.
Thank you so much.
No, it's first of its kind in Asia.
Yeah, it really is.
And it's making healthcare for LGBTQ much easier.
Yeah, that's the goal.
Yeah.
We want to create an inclusive care where everything is so easy.
So let's talk about chemsex.
Yay!
Not yay. Okay. It's like a new rising issue for LGBTQ. Why is that, you think?
Of course, because there's so much stigma around it. Whenever people feel stigmatized, they don't open up talking about their issue, right? And therefore, they cannot seek help. And the issue that they're facing is become even more issue when there's no professional to help guide them through it.
It's not easy at all to find experts who can support you throughout your journey in especially chemsex. And I think a lot of people get into chemsex because of the stigma, as you say, because they want to feel confident in sex, but one part of them is also shame.
I always say that healthcare issues often derive from the fact that issue related to patient's identity directly. That sort of relation is actually stigmatization. People usually relate chem use with being a bad guy.
Taboo.
Yeah, it's taboo. If you open up about, hey, I'm doing chemsex, you're immediately a bad guy. You're immediately a bad person. And that's why people, cave in and they want to talk about their issue, and that's not good.
Why do you think chemicals are so effective and strong to control a person,
I think human is an animal of habit. With all these substances, when you use it, there is some rewarding system in the brain. Some neurotransmitter is being released, and it teaches your brain, hey, actually this is something that's good. When you do it, there's an escapism that comes with it, that you escape from reality, that all of a sudden all these concerns that you have in life disappear. I think these two are the reason why substances are so strong when it comes to controlling someone's life.
Chemsex can increase the risk of getting HIV and STDs. What's your take on that?
I totally agree. When you do chemsex, sometimes you lose some part of your inhibition and you tend to take more risks, or sometimes you're just completely not conscious at all of what you're doing.
Would you say that chemsex people are more weak than normal people in terms of psychological?
I wouldn't say they're weak. Maybe they're even stronger than people who haven't experienced it, because they went through more. But they are more vulnerable to other factors that can affect their mental health.
More sensitive.
So that's how I would put it.
How would you see a person in chemsex? What does his journey through addiction look like?
I think there are two main entry points. One is the one who started using substance from sex. They may have met someone who introduced them to chemsex, and that's their entry point. The other group is that those who start from using substance for recreation, like from party, and then they slowly get into chemsex, right? And along the way, the journey is usually they don't think it's an issue. They think they can control it, right? That's a phase we call pre-contemplation, contemplation, and then slowly
Use more often.
used more and more often, and slowly realize that, oh my God, is it really affecting my life?
Problem now, yeah.
It's a problem now. When they realize there's a problem, there are two types of people. One who refuse to do anything about it. They just give in and they just continue with the escapism. There's then another group, maybe like you, that try to get up and do something to change their lives. And usually they cannot do it on their own. They need social support. I always see they have a boyfriend, they have a family to get them out of it, to take them to see a medical professional. That's a point where, I can help guide you throughout the process.
So Pride Health is also focused on chemsex recovery.
We do have a team of psychologists and psychiatrists who are very experienced when it comes to substance use. And we can help guide you not only through recovery, but also throughout the addiction process to prevent relapse and also for recovery, as you said.
Yeah.
Because recovery for me is not only just about psychology, right? You have to make sure that your body is ready
Physical is
for that
also
recovery.
good,
Yeah.
In your experience, the recovering addicts have to change to heal.
For them, but the answer is always there is always an underlying cause somewhere that you don't realize. Maybe you have a childhood trauma from certain things, maybe addiction personality from some specific event in your life. And you have to dig in to find out. And then you do something, see a psychologist, and they will have a way, we call it cognitive behavioral therapy, right? To change perspective on how you see that specific event. And slowly you can get yourself out of that addiction pattern.
Another way is also get them motivated
Yes,
about healing.
you're absolutely right.
But they have to ask to heal themselves. No one can save them, I had to save myself. But I feel like support system was so important.
Yeah.
I wouldn't know how to do it by myself. But I had a friend who was, now today my boyfriend, who supported me all the way through. But it's quite, so for people who don't have, friends or boyfriends or family to support them, where can they seek help?
I think they can come to healthcare providers for help. That's why we're here. We want to be a safe place. They can come to us and they can be assured that there will be no discrimination whatsoever they can be assured that their problem will be dealt with in a way that is very professional. We will not only deal with their physical part or addiction part, but we will also take care of them mentally and spiritually as well.
Can come to Pride Health.
You can come
for
to Pride Health.
Consultation.
Yeah, or actually any healthcare provider near you. You know, if
Yeah.
you're in a suburb area and you have, you know, a community psychologist, go to them, open up, talk to them about it. I'm sure they'll be willing to help.
So do you think therapy is important?
Super important. You know, I went through a depression myself. I still see a therapist regularly, once a month or once every 2 months. Even though now I'm super happy, you know, but I still see therapy as a way to readjust my focus, reshape how I see things, to help me equipped for the future stress that I might face, to make sure that I'll be okay in the future. In Asia, there's so much stigma around seeing a therapist.
Getting help, you know.
Right?
By seeking help, they see that you are crazy.
Yeah.
You are, weak.
Yeah.
But actually, seeking help is the way to love yourself.
It is the way to love yourself.
It's the way to take care of your mental and physical.
Yes, I totally agree.
It's self-love for me.
It is self-love. You feel better after therapy, right?
Honestly, who does therapy for me is my boyfriend.
Oh, well, that's
he gives
in a
me
way.
like the truth that people don't see. Like, I do a lot of reflections on how I see myself. I honestly feel that if you don't have anyone who you can talk to, be that strength for you, then go for therapy. It's not scary at all, and then you can be confident. So relapse is common for people in recovery. What is the best way to get people back on track after they slip or relapse?
Number one, remove stimulants, right? If you do have an apparatus or tool that you use for, substance use in your house, just throw them away. If anyone that you know, your friends, your boyfriend is doing it, please cut them off. Otherwise, you're gonna keep going back to it. And then you have to set boundaries. What are the things that you would never let in? What are the behavior that you know that when you do it, it might lead to substance use? If you feel like every time you go out, you end up doing drugs, then you have to refrain from going out. If you know that every time you go into an anxiety attack or panic attack and you seek drugs, then you need to control that. And of course, number three would be to seek professional help from healthcare providers. There's medications that you can take to reduce craving, to reduce anxiety, to make sure that you don't go back to relapse.
So, Bar, this way, as a LGBTQ icon yourself, what do you want to express to the world today?
I want to encourage people to come out and speak up for themselves. You can be an advocate for yourself. When you do, you slowly transform the community, the society that you live in, and that will help bring benefits to other people around you who is going through the same journey as well. And especially with healthcare, I want to encourage people to be yourself when they receive healthcare. Of course, if you meet the right doctor, it's gonna be easy. But if you meet the wrong doctor, just don't get faced by it. And I think that's what I want to say today.
I mean, if you feel you're not okay with your doctor, change the doctor. Yeah, try a new one. It's not the end. And there's always Pride Health today.
Always.
So Pride Health will help you find the right one.
The right one, yeah.
And you're on it. You're on the...
I'm on it. I mean...
You can go and pick...
You can pick me.
Yeah, sure.
Yes.
So thank you for creating Pride Health platform. I hope that you will be the force that drive the healthcare to the next level. Bye-bye.
If you like this content, please hit like, comment, or subscribe to Taylor Srirat.